It's a hard one to find rationale of why this would benefit Ohioans in general.
Continuing coverage of a story we first brought you last night, Ohio Governor John Kasich's proposed budget could mean changing the Medicaid income cap for pregnant women. The proposal lowers that cap from around $23,000 to a little more than $16,000. But that change isn't sitting well with Valley lawmakers and a nonprofit pregnancy center. 27 First News reporter Julie Bercik explains.
The Pregnancy Help Center store has almost everything moms need for their babies. Parents earn points for baby food, diapers, and even clothes. Education is a big part of what the nonprofit does.
We want them to have healthy pregnancies. We want them to understand what it's all about being a mom.
Prenatal care plays a big part in a healthy pregnancy and improving the infant mortality rate.
The chances of more babies dying before birth or right after birth is even higher if this budget cut goes through.
Governor Kasich is proposing changing the Medicaid eligibility for pregnant women, lowering it by almost $7,000. The state says Medicaid was expanded 2 years ago to cover 138% of the poverty level, reaching more than 500,000 Ohioans who had nowhere else to go for coverage. If a pregnant woman isn't eligible for Medicaid, she can apply on the federal exchange.
One of the catch-22s is if there's not open enrollment, they can't sign up.
It's just the wrong time. It's the wrong population. I understand cost savings, but we're supposed to be taking care of these folks.
State Senator Joe Schiavone says there are amendments in the Senate to take this out of the budget.
It's terrible timing for it. I mean, we have an infant mortality rate, not just in Youngstown, but in the state of Ohio, that is absolutely terrible.
If the budget passes, pregnant women right now would still be covered. The change would take effect in January. In Youngstown, Julie Bercik, WKBN 27 First News.
First News reached out to the governor's office and it connected us with a Medicaid representative. He explained the open enrollment situation as a glitch in the federal government system. It's not something the state can fix. Federal law also requires health care coverage for everyone.